Welcome. We're going to talk today about fibromyalgia pain. What is it, what causes it, and what you can do about it. I want to share just a few moments about the perspective I'm going to share. Because in my experience, there's two perspectives that are kind of like opposite poles. There's the conventional medicine view, which is very research based, which says basically we don't understand what causes fibromyalgia. You have increased pain sensitization, take these drugs, do some therapy, and get used to it. And on the other hand, on the other pole, you've got kind of a more natural healing complementary medicine world. And there are a lot of great people out there who have their one thing that they do. And the one thing can help part of the physiology of fibromyalgia, but it doesn't necessarily address the integrated picture of what generates the symptoms and creates that sort of cycle of worsening pain and disability and other symptoms. And my view is an integrative view. As a medical doctor who spent 20 years seeing tens of thousands of patients and studying all the literature, what I can tell you is that there's a lot in the medical science that tells us how to understand what causes complex chronic pain, what causes the various symptoms of fibromyalgia, and how they all fit together in a cohesive whole. And so that research understanding and critically thinking about that research is important to you. It's important for you to benefit from that information. And then there's the complementary approach because, in Western medicine, we don't really know so much about health. We know a lot about disease. We know a lot about treating disease. But what I can tell you quite clearly is that your own body-mind system has tremendous capacity for self-healing. And the question is, how do you stimulate it? How do you activate it? And that's part of the strength of many complementary practices and practitioners. And I can say from my own experience, seeing the incredible power and change that so many patients have had from doing the right kind of movement, mechanical, structural treatment, from doing the right kind of diet, nutritional treatment, from doing the right kind of mind-body consciousness treatment. And so I'm going to express an integrative view of all of those, and I hope it's interesting to you. I'm going to share at the beginning kind of conceptual stuff about what and why of the pain in fibromyalgia, and then talk more practically, and at the end to get into some very practical, simple things that most people can do for themselves or get a little help from their family practice doctors. So that's how this is going to go. Let's jump into it. I hope it's a nice trip. I hope we learn good things. And before we go, I just want to also acknowledge that healing starts with you. And I've seen this so many times in my career that the real thing that enables one person to heal from a chronic problem and another person not to heal has to do with mindset and outlook. Willingness to be open, to try new things, willingness to actually access the intelligence that lives inside of you. And you've got that, everybody's got that. If you're watching me and you're understanding half of what I say, you've got more health than illness. So just remember that as we go. Don't get hung up on the details, and let's get moving here. All right. I'm going to share some slides because I want to be able to put things in pictures because some people learn visually and not just verbally. So let's get into this a little bit, and I'll hang out here in the corner and potentially periodically pop up, right? So pain is not like a light bulb. Your pain system is not like a black wire, an electric wire, and a white wire, and you flip the switch and then suddenly the light goes on. Your pain system is incredibly complex. You've got a pain transmission system. Genetics, conditioning, biochemistry, structure, hormones, beliefs, emotional states, nutrition, all of these things can have a huge impact on your pain transmission system. So let's have a little look at that pain transmission system and see if we can understand what is it really, what's going on with it. Here's a schematic of your pain processing system. This is from Scientific American. Here's like your hand, and imagine in your hand something hurts you. You get stuck or you get an infection or a wound or something like that. You have actual pain receptors. They call it nociceptors. And those pain receptors get activated and they shoot an electrical signal that goes up the nerve. And that nerve, which is kind of in this cartoon here, is a whole bunch of nerves that travel up your arm and they get up to your spinal cord. And in your spinal cord, you got what you call synapses. Synapses are like relay stations. It's like one nerve brings a signal in and it jumps over the synapse, which is like a little gap between the nerves. There's a little chemical process of chemistry that the electrical signal comes down, releases the chemicals are received here, and boom, you've got a nerve signal that goes up to the next nerve. And look back at the picture here, that signal goes up your spinal cord through various pathways. One of the main pathways goes right to the sensory processing area of your brain, in your thalamus, in your midbrain. There's another set of synapses, and from there it jumps over and it goes up to your sensory cortex, kind of in the side of your brain, and that's where your brain says to you, I've got pain in my hand. The key thing I want you to take from this picture is that you have a pain processing system that processes the signal. There's multiple steps between nociception, activation of that pain receptor, and perception. So that system is altered by various things. You've got amplifiers in your spinal cord, in your brain, at the place of those synapses. Because we're not talking about one nerve from your hand to your brain. We're talking about thousands of nerves. We're talking about nerves that are coming from your brain and going into your thalamus and going down into your spinal cord, conditioning those signals, turning them up, turning them down. It's a very complex process. And it's kind of like you've got an amplifier. This over here is an amplifier. You take your MP3 player and you play a little song on it. You can kind of barely hear da 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 da. You plug it into a big receiver amplifier and plug it into big speakers. Da da da. You got a huge song that's blasting out the whole house. So part of what's going on in fibromyalgia is that pain processing system is turned up. And there's a lot of different things that can turn it up. There are certain things that are classic in fibromyalgia, and there are certain things that are not necessarily fibromyalgia that can turn up the pain processing system. Let's think about that a little bit together conceptually. Here's a little diagram on the bottom of the pain processing system. And what turns up the volume? Well, yeah, there's this process called sensitization, and that just means the volume's turned up. That can happen in the nerves in your arm or your leg or your back or wherever, and that can happen in your spinal cord and in your brain. We call one peripheral sensitization, like in the arm or in the leg or in the body itself. And then central sensitization means in the spinal cord and the brain. Those are two related but different processes. When one of them happens, the other happens. If I've got persistent pain in my hand, my nerves in my hand immediately start to do changes in protein synthesis and ion channels and all these different things that can sensitize it. I don't know if you ever noticed, like you hurt one thing and it gets infected and then you start to get an area around it where it hurts. That's an aspect of sensitization. It's also an aspect of immune activation in the area of that pain. Similar things seem to happen in the brain and spinal cord where the volume gets turned up. Sensitization. The persistence of pain can cause sensitization. Various hormonal changes, hypothyroidism, hyperthyroidism, changes in your adrenal hormones like epinephrine, norepinephrine, and cortisol. Inflammation locally or inflammation in your brain, whether that's the kind of inflammation that your family doctor thinks about where things are red and hot and swollen and tender, or if it's the kind of inflammation that recent research is showing us underlies most chronic illness, which we call sterile inflammation. It's more like an altered immune system rather than a big inflamed joint or part of your body. But altered immune functioning is very much part of fibromyalgia, and that seems to be part of what turns up the sensitization. Neurotransmitters, you've heard of things probably like serotonin and epinephrine and norepinephrine and dopamine and GABA. These are things that modulate the signaling in your brain and spinal cord. Negative emotions and beliefs alter pain. A lot of people have heard of Dr. Sarno. He's got one view, and he's kind of made famous this notion of pay attention to what's going on emotionally, because sometimes what's going on emotionally can actually affect your pain transmission. I think it's wrong and distorted to say, well, that's all that's going on in fibromyalgia, because it's more complex than that, and there are real physiologic changes happening, as we'll talk about soon. But the notion of your emotional state and how you perceive pain and the kind of emotions it generates, that's part of altering your pain transmission system. There's a construct that's called catastrophizing, and it's measured in a lot of medical research. And people who catastrophize are people who feel something unpleasant and they think the worst and they get anxious about it. And it's been shown a number of times over and over that people who are catastrophizing tend to have amplified pain transmission. What else? Beliefs, biochemistry, nutrient, stuff like vitamin D, vitamin B12, magnesium. These things are all involved in modulating pain processing. It's more complex than that, but I'm sharing those because those are things people know about. Just like you have things that turn up the volume, you got things that can turn down the volume. That's good. That's what medications do, whether it's opiates or medications like Lyrica or Cymbalta. Those things modulate neurotransmitters and turn down the volume on the pain transmission system. Aerobic exercises produces biochemistry that reduces pain transmission. Positive emotions, purpose, meaning helps people cope with pain. And it's not just that they're distracted and they're not paying attention, it shifts biochemistry in a powerful way. And again, biochemistry and nutrients can have a huge impact. We'll talk more about that as we go on. Hope you all are good with that so far. So, just kind of summing that up, right? Your pain experience is kind of a coming together of three different things. There's nociception, what's happening in your tissue. There's signal processing, what's happening in the nerve, in your spinal cord, and in your brain. And then there's the way you process it and the meaning and beliefs and understanding and emotional responses you have. All of that is what creates your pain experience. I like to break this down and kind of create or just sort of make a little map, right? And in my map, based on seeing 40,000 patients and studying a lot of science, you got mainly three different worlds of your body-mind system. Obviously, it's one world, but these are like three handles. These are three different ways of understanding what's going on and three different ways of organizing what you do to help yourself heal. So it's important to get this idea because let me talk about it and then talk more about why it's important. What are these three things? I call them 3M's to make it easier. There's kind of metabolism, there's movement, and there's mind. What do those things mean? The 3M's, right? Metabolism is all your biochemistry. It's your immune system. It's your state of oxidative stress, which is kind of like biochemical stress that happens in the body and is a huge part of chronic illness. It's your hormones. It's your biome, all those bacteria that live in your gut and all the biochemistry they produce that affects your gut function, affects your brain function, affects everything in your body. It's your nutrients. It's toxic exposure. That's all metabolically active, biochemically active stuff, and that's where a lot of the changes happen in fibromyalgia. That's why you have fatigue and pain sensitization and irritable bowel syndrome and brain fog, small fiber neuropathy and all that kind of stuff has to do with your overall biochemical metabolic picture. You got to address that if you want to heal. Next is your movement systems like your muscles, bones, joints, connective tissues, all the stuff that helps you get up and move around. And not just that, it actually forms the structure on which your organs function. I've got connective tissue wrapped around my liver, holding it in place in my belly. My lungs are held in layers of connective tissue that allow my lungs to inflate and move. If someone leans on my chest and my ribs get depressed, my lungs can slide out of the way and my heart slides in between them because of that connective tissue thing going on. If that's not healthy, my organs get unhealthy. By the same token, I can have various problems with my structure that are painful, and there are things that happen in parallel with fibromyalgia. So if I've got arthritis in my knee, or if I've got a herniated disc in my back, or if I've got an old broken rib or fractured bone and there's all kinds of tissue restriction around it, that's going to be a focal pain generator. That's going to generate nociception, and that's going to feed into my sensitized pain pathways if I'm someone with fibromyalgia. So addressing those focal mechanical structural issues is very important, but it doesn't get at the whole picture. By the same token, fibromyalgia itself can actually generate issues with my structural system. If I'm in chronic pain all the time and I'm not moving, I'm going to get deconditioned. My muscles are going to get weak. I'm going to lose coordination. When I start trying to use my muscles again, they're going to be vulnerable to getting hurt and generating more pain. And on the flip side of it, we'll talk about this later, if I'm moving regularly, I'm actually generating healthful biochemistry. We're going to unpack all of this more, okay? But I'm just giving you an overview right now. Let's talk about the mind aspect of this 3M's picture. That's your thoughts, your emotions, your awareness, your belief systems. Powerfully important. Trauma, chronic stress, genetics, anxiety, depression, all of those things can worsen and actually generate chronic pain because of the way they create a hyperactivity of the stress response. It's incredibly important to understand your stress response. You've got a stress response, relaxation response. They're meant to be in balance with each other. If they're out of balance, and if you're in a chronic stress space for weeks, months, years, and decades, that changes everything, including your metabolism and biochemistry and your pain processing. And that can be a huge issue that underlies and kind of sets the stage for people to develop fibromyalgia later in life. So, moving forward. So, talking a bit more about muscles, bones, joints, we might have covered this already. Yeah, focal pain areas, arthritis, muscle pain, nerve compression, bursitis, these are pain generators. And then we've got the effects of fibro, like I talked about already. What do we do about it? There's the right exercise. And there's mainly two kinds or three kinds of exercise. There's strength and coordination and range of motion type stuff. And there's aerobic exercise where you're like puffing and puffing. And we know that those things have different effects and they're all beneficial. We know that it can be incredibly difficult to exercise with fibromyalgia because for reasons that I'm not going to go into detail today, but whatever. We'll talk about it in another video. The point, though, is that you have a low threshold in fibromyalgia. And if you try to exercise too much, you can flare up your fibro. But movement is incredibly important, and you need to find what's your envelope of comfortable movement and work with it and gradually increase it. And then there's physical treatments. Skilled movement training, whether that's yoga or Feldenkrais or Pilates, where you actually learn to reestablish the coordination of your neuromusculoskeletal system, where you learn to stretch and open up your joints and give space and kind of get your connective tissue system functioning more effectively. Manual therapy is when someone puts their hands on you and helps your tissues function better. That can be massage, and that can be osteopathy and craniosacral therapy, or it can be chiropractic. Acupuncture is a mechanical, structural, energetic therapy. These things are incredibly important, and they can do valuable things to help the function of that structural functional system, which is also an energetic system. That's another topic too, like what is your energy system? It's a real thing, but let's not go there now. But again, these aren't the whole picture. I've had people come to me who've said to me, well, yeah, I've had fibromyalgia for a while, and I've done massage, and I've done yoga, and I've done craniosacral therapy, and I've done stretching, and I get better for a while, but then it just, and the issue is they're not getting the 3Ms. They might be walking around with a huge chronic stress activation thing where their stress system's on overdrive, and that's contributing to a biochemical metabolic state of inflammation and hypersensitivity and kind of cellular protective responses that keep driving the fibromyalgia. So that's why it's important to think about the big picture of 3Ms. But metabolism, again, all of the biochemistry of your body. This is going to get a little complicated. Bear with me. I want to give you a big picture, not to try to explain everything, but what I want you to take away from this, and this is very important, is that there are a number of biochemical changes that have been identified in people with fibromyalgia. Part of healing is addressing that biochemistry. And there's a dietary thing, there's a nutrition thing, there's things with meds that are regular meds, there's things that are meds that are out of the box, unusual things. I'm going to talk in more detail about this and make some general suggestions about things that are often first line things that I suggest to people in my practice. So we'll get to that. Why does everything hurt? That's the question, right? So this is the mainstream medical point of view because this is what's been demonstrated. I think it could have something to do with the fact that we've got some huge pharmaceutical manufacturers that picked up on the research of central sensitization and said, Lyrica, Cymbalta, gabapentin, we've got these great drugs to address central sensitization, and they went around and kind of pushed that. I'm not a conspiracy theory guy, but money has an influence on healthcare. And the pharmaceutical industry has an influence on healthcare, not only the way doctors think in the office, but also what research gets funded. And so we've had this 20-year romance with Lyrica and Cymbalta, and then more recent studies showing wow, it doesn't seem to be as effective for as many people as we thought. And then my own experience with a lot of people who come into my office, they say, well, yeah, this helped me at first, but it doesn't anymore. And some people say, this helped me 80% and it's great, I want to stay on it. Great, it's a solution, good. But some people just have horrible experiences and have hard times getting off of the meds, etc., etc. So the question that I started asking decades ago is, well, why central sensitization? We know it happens, but that's not a cause, it's an effect. What's the cause of central sensitization? When we look deeper in the literature, we start to see some things. We see that there are cells in your brain that are called glia. Literature, we start to see some things. We see that there are cells in your brain that are called glia. What do glial cells do? Glial cells get activated and they create hyperexcitability of your brain. There's a neurotransmitter that's called glutamate, and glutamate is an excitatory neurotransmitter, and glial activation makes your neurons produce more glutamate, so the cells are more like ready for those signals to come through, and that's part of how things get sensitized. That's probably part of a lot of the different problems that happen in fibromyalgia. We're just beginning to elucidate that. For instance, like small fiber neuropathy, where when that was first discovered, everyone wanted to say, oh, that's why people have fibromyalgia, because small fiber neuropathy creates sensitization. But then they started doing studies with animals and rats, and they did things to sensitize their brain and make more glutamate in the brain. And when the rats have more glutamate in their brain, they develop small fiber neuropathy. So it's not quite so clear. You know, it's kind of another pet peeve of me that, like, every time somebody finds a physiologic issue that's related to fibromyalgia, they want to say, oh, we found the cause. And no one's looking at kind of the big picture and seeing how all these so-called causes are related in cycles of causality, how they relate to each other. Let's not go there now. Time for another. For another lecture. But the point is, glial activation, central excitability, glutamate toxicity creates central sensitization. It's worth knowing that there's another neurotransmitter called GABA, which balances glutamate. When they're in balance, things are cool. When there's too much glutamate in relation to GABA, you get central sensitization. That may be part of why medications like gabapentin help some people. It may be why there's actually a neurotransmitter, GABA, that you can take as a supplement that helps some people. Part of the issue with GABA as a supplement is it doesn't always get into the brain, except if you've had compromise of your blood-brain barrier. So that's probably why it doesn't help everybody. Time for another story. Let's talk more like, why do the glia get activated? Because the glia activation is not a cause, it's an effect. Oxidative stress, inflammation, whether it's central, meaning in your brain and spinal cord, or peripheral, meaning in your blood. But oxidative stress is kind of the biochemical stress that happens when you have inflammation. And inflammation and activation of these inflammatory chemicals called cytokines are part of what creates glial activation and part of what actually directly sensitizes the brain. And that's part of what's driving this process. Yes, we need to ask what causes that, and it's a good question. But let's think about other things that cause central sensitization and glial activation. We talked about the stress response and how a person who's got an overactive stress response for years and decades, who's had trauma, who has a genetic predisposition, who's been sick over and over and over again, multiple injuries, car accidents, whatever it is, surgeries, acute illnesses, can generate this overactive stress response, shifting in our stress hormones like cortisol, epinephrine, norepinephrine, that it itself can create sensitization and it itself can drive glial activation. I'm not going to show you all the arrows of relationship here because it's just like way too overwhelming. But sleep disturbance. Anyone out there with fibromyalgia have trouble sleeping? I can speak to sleep disturbance as a medical resident when I was working 36 hours straight. Week after week, 2 or 3 times a week, and just feeling like I was hit by a truck. You are meant to have a sleep cycle of deepening stages of sleep. If you're waking up frequently for any reason, whether it's pain, anxiety, having to go to the bathroom, noise in your neighborhood, whatever it is, if you're not getting deep sleep, your body's not restoring itself, and that itself can cause chronic widespread pain. Sleep apnea can cause widespread pain. If you're snoring and you're not sleeping, or you're snoring a lot at night or kicking around and your sheets are kicked off in the morning, get a sleep study and check it out and figure out how to get good sleep. In my practice, I do a whole stepwise set of things to try to help with sleep. We'll talk about that a bit later. Sleep can feed overactive stress response and stress hormones. Sleep disturbance can feed inflammation. Again, I can't show all the arrows because it would make it crazy. But the point is, all of these things are related. Mitochondrial dysfunction. Mitochondria are organs inside your cells. Your organs, like your liver and your brain and your muscles, have cells. That's what makes them up. The cells are specialized in each organ, and inside your organ cells, you've got these little microorgans or organelles that are in your cells. Mitochondria produce cellular energy. They're specialized depending on what kind of organ they're in, whether it be brain or heart or lung or liver or intestine. And mitochondria produce cellular energy, and they're incredibly sensitive to all kinds of different danger signals, whether it's from inflammation, stress hormones, other hormones, toxins. Mitochondria are incredibly sensitive. The recent research that's showing up is suggesting that mitochondria are one of the sort of fundamental kind of like danger detection systems, and mitochondria can shift into a protective kind of survival mode where they don't produce as much energy, where they contribute to dysregulation of your stress hormones and your sex hormone axis. So they're really involved in so many physiologic reactions. They're involved in making your cellular energy, and they're involved in creating central sensitization. When mitochondria get dysfunctional, they produce oxidative stress. Oxidative stress creates mitochondrial dysfunction. So this is a little bit of a vicious cycle there between inflammation, oxidative stress, mitochondrial dysfunction, stress hormones. These things are dancing, right? And that dance goes on over time. When you start to have fibromyalgia symptoms, that dance has been going on for a while. Part of healing is reversing this biochemistry. Anxiety, depression. Whether you had anxiety and depression for years, or you developed anxiety, depression after developing chronic pain and all these different medical problems, it's really important to get over that idea of trying to decide what causes what, because it loses its relevance. We're talking about vicious cycles. We're talking about complex multifactorial system that you are. And we're talking about a lot of different systems within that that are part of what makes up your biochemical and systemic makeup. I want to try to express that in the next slide, right? So here on the right, we got fibromyalgia syndrome, with all the things that you may be experiencing, or that you may experience some of these things: pain, sleep disturbance, fatigue, exhaustion, gastrointestinal problems like irritable bowel syndrome, cognitive problems, emotional problems, other issues, whatever they are. And I want to talk about antecedents, triggers, and mediators, because it's helpful in understanding chronic illness. This is very different than the way I was trained, very different than the way most doctors are trained. And in my eyes, this is part of why most doctors don't understand fibromyalgia and chronic illness, because they're still looking in an acute model where they're saying, well, what's the one cause of the problem? One thing creates the problem. Let me identify that one thing and fix it, and then the problem will go away. But fibro, like a lot of complex chronic illnesses, is multiple factors. You got antecedents, which are like the fundamental things going on early in life. Like imagine the trunk and the roots of the tree. Your genetics, your early life experiences, people who've had trauma, people who've had a lot of chronic illnesses, gotten a lot of antibiotics, developed autoimmune diseases at early ages. That's a situation where the body is set up for inflammation, oxidative stress, mitochondrial dysfunction, hormonal dysfunction, emotional mental stress, chronic pain. Triggers are things that happen at various points in life that shift the system. And then mediators are the things that kind of perpetuate it. It's kind of like what's going on that keeps the whole thing going along. For instance, a lot of people come to me and they say, oh yeah, I had some hard stuff going on in my early life, but you know what? I dealt with it because I'm a tough person, and I went to school, I got a job, I lived my life, I got married, I had kids, I was working really hard, and then I got in this minor car accident, or I got a viral infection, or I got a bad infection, I was in the hospital with pneumonia, and then everything unraveled and went down. I had surgery, and then everything started to unravel. That was a trigger, and that trigger shifted the physiology and started a bunch of changes. And maybe That person who had a car accident, they had a headache, they couldn't sleep, and they still haven't been sleeping. That's a mediator, because chronic sleep disturbance shifts your physiology. That person who had an infection that was a trigger that created immune dysfunction, and that immune dysfunction becomes a mediator. So let's flesh this out, right? We got antecedents, early life experiences. Could be genetics, it could be something that happened, trauma, illness, whatever it is. Some trigger pops into that system and shifts what's going on. And then some mediator, which kind of becomes a trigger and feeds into the system and generates fibromyalgia. That's the way my integrative medicine colleagues understand fibromyalgia. That's the way we treat it, and that's how people get better. So let's open this up. We talked about all this a little bit. And then triggers, trauma, illness, viruses, toxic, infectious, gastrointestinal illness. How many of you out there have had one of these things that seemed like a trigger? Or how many of you have had some kind of thing where, you know what, I got 3 family members with chronic pain or fibromyalgia or substance abuse or depression or anxiety. That's a genetic predisposition. It's not a sentence. It's not a life sentence. It's a predisposition and something that you could choose to work with and try to address in an intelligent, rational way to kind of work with it. Or early life trauma, illness, exposure, whatever it is. What kind of mediators? Again, we talked about this a little bit in the previous slide. Central sensitization, inflammation, mitochondrial dysfunction, hormonal abnormalities, immune system dysfunction. All of these things are mediators that feed that vicious cycle. The fundamental process of healing fibromyalgia is starting to unravel these cycles, starting to peel off the things that are most relevant. That's the most fundamental way of getting at the pain of fibromyalgia. And then there are also things that can be done that are more like, okay, let's go where the money is now. I'm in pain. I'm suffering. What am I going to do now? So we're going to talk about that in a few moments. But I hope that's been a picture of that sort of metabolic picture. What are the priorities for addressing this metabolic biochemical system? So first of all, if you have an acute illness, that's a priority. You got to deal with that first. Because if you're sick and you've got some sort of infected ulcer on your leg or chronic infection in your bowel or bladder, and you're not addressing it, you're going to be having this chronic inflammatory cascade going on. You got to sleep, and sleep can involve a lot of different approaches. I'm not a big fan of sedative hypnotic meds like Lunesta and benzodiazepines and Klonopin, because those things create a dependency and they mess up your thinking and they can feed into the cognitive dysfunction. I'm more of a fan, if a person really needs meds, of using a low dose of some of the antidepressants that can really work, like trazodone or mirtazapine. And obviously, I'm not giving medical advice here, and I'm not telling you what to go yell at your doctor about. These are things that I do in my practice. These are general things for addressing these. But if someone's sleep disturbance is bad enough and they're willing to try a sleep med like that in a low dose, that can sometimes have a huge impact, because when you start getting 7 or 8 hours of sleep at night, that can be a life changer. Someone who has a hypercortisol thing going on, there are actually botanical compounds that can help modulate cortisol levels. Things like phosphatidylserine and ashwagandha. There's botanicals that can reduce that hypercortisolemia and help you sleep. Cortisol, your stress hormone. I don't think I really talked about this so much. Cortisol is your chronic stress hormone. And usually you get a bump in the morning around 6 o'clock, and it comes down during the day. In the afternoon, you get a tiny bump, 4 or 5 in the afternoon, and then it goes down so you can go to sleep at night. For some people, that gets all turned upside down, and there's this is complex physiology. Some people get a big bump of cortisol in the afternoon and the evening. If you're one of those people where, you're tired all day, and then 5 or 6 or 7 or 8 at night, you get wired, and you're just going, and you can't go to sleep until 4 o'clock in the morning, that is not a state of mind that's going to let you heal from fibromyalgia. You need a rhythm that matches the rhythm of light, right? You've got a hormone called melatonin in your brain, and it kind of opposes cortisol in some ways. Melatonin is also helpful for many people with irritable bowel syndrome. It's got anti-inflammatory effects. You want that when it gets dark, you get melatonin in your brain. So be in a dark place. Start to pull back from busyness and screens. Blue screens, computer screens, are neurostimulants. Stop it at 6 o'clock at night, or if you need to work on a computer at night, get a filter that shifts it towards the red side. I can't go into all the details because there's so much to talk about. Meds, like we talked about. And again, addressing the underlying issues that can kind of drive the whole physiology of fibromyalgia can help with sleep. The rest of the biochemical picture, diet and nutrients, is one of the best ways to address inflammation and dysbiosis. Um, there's also something called LDN, which is a off-label use of a pharmaceutical that in a subtle way reduces those inflammatory chemicals and reduces glial activation in people with fibromyalgia. There's other nutrients as well. I'll talk about that a bit more. Again, the oxidative stress thing, there's a diet and nutrient approach to that too. I'm not going to go in detail on this. I'll talk a little bit, sort of a big picture at the end. I'm trying to give you an overview that addressing these underlying physiologic issues is really important, and it can be done with lifestyle things without drugs. Addressing the fundamental aspects of health, like sleep, diet, nutrient, spending time in nature, connection with people you care about. It's all really important. Okay, so what we've been doing so far is sharing an overview of really what are the physiologic aspects of fibromyalgia that contribute to pain, so that you can understand the rationale for the things that you can do to reduce the pain and other symptoms. I broke it into 3 M's. The 3 M's are the movement system, the metabolic system, and the mind-body system. So far we've talked about movement and metabolic. We're going to take a little break right now so that this video isn't too long. You can click right into the next video below this. The link will be there, so you can go to the rest of this class if you'd like to see it right now, or you can watch it later. Please go ahead and go also to the bottom right of the video and hit the subscribe button so that you'll get notices when I make new videos. And if you want to get on the mailing list and join my online community, you can go to the link that's in the notes below, which is whathealsfibromyalgia.com. That's one word. And there you can sign up to get announcements about blog posts, about new videos, about live events, and other things that may be of interest if you want to heal fibromyalgia with an integration of natural medicine and conventional medicine. So thanks for being here.